Good evening, my name is Alexis Munguia, student nurse on the ICU unit. I'm calling about a 70-year-old male patient admitted for pulmonary recital embolism. I'm concerned because the patient is currently hypertensive and has had a recent syncopal episode. Given his medical history, I'm worried about a possible hemodynamic instability and potential neurological complications. The patient has a history of hypertension and recently went a craniotomy for meningioma on March 10, 2026. Following that, he was diagnosed with a pulmonary embolism confirmed on CT chest. He went a thrombectomy and had an IVC filter placed on 4/19. He is currently on a continuous heparin drip, 1,502 units per hour for anticoagulation. Recent labs indicate an elevated white blood cell count, suggesting possible inflammation or infection, and he continues to be managed for anticoagulation therapy. On my current assessment, the patient's vital signs are as follows. Blood pressure is 175 over 105, heart rate is 110, respiratory rate 16, and oxygen saturation 96 on 2 liters via nasal cannula. Despite administration of metoprolol 25 milligrams orally, the patient remains hypertensive and tachycardic. Lung sounds are clear and he is not currently in any acute respiratory distress. Neurologically, the patient is illiterate 10 × 4. However, due to his recent craniotomy and the syncopal episode, there is a concern for possible intracranial complications such as increased ICP or bleeding, especially considering he is on anticoagulation therapy. Overall, I believe the patient is at risk for both cardiovascular instability related to his pulmonary embolism and neurological complication related to his recent surgery and anticoagulation. At this time, I recommend further evaluation of both his hypertension and neurological status. Specifically, I suggest reviewing and possibly adjusting his anticoagulation therapy in relation to bleeding risk, evaluating the effectiveness of his current antihypertensive regimen, and considering additional or alternative medications, consulting cardiology for management of his hemodynamic status, consulting neurology or neurosurgery for further evaluation given his recent craniotomy and syncopal episode. Please let me know if you would like any additional labs, imaging, or interventions initiated at this time. Thank you.